With the plethora of drugs and mechanisms of actions being developed in myeloma, with all the FDA approvals we've had in the past 2 years, it's very important to take a 30,000 foot view of what's happening in the field, and that's what I tried to do in this particular talk. I touched upon the fact that myeloma is quite heterogeneous from a disease biology standpoint, with the burden of disease that patients present with, as well as the baggage that they're bringing with them from comorbidity standpoint, and how to navigate that piece of it as you're planning treatment at the time when they're diagnosed, as well as with subsequent relapses, and what therapies may make sense from not just the efficacy standpoint, but from the disease biology and patient factor standpoint. I touched upon the immunotherapies, the newer immunotherapies that are being developed, targeting not simply the myeloma cell, but also the checkpoint inhibition pathway, as well as the bone marrow microenvironment. So I touched upon some of those targets that are being studied, and then also shared the available data that we have in the clinic with the checkpoint inhibitors in myeloma. There's a lot of data being generated within the immunotherapy umbrella. And immunotherapies, ranging from monoclonal antibodies, antibody drug conjugates, BCMA-specific CAR-T cell therapies, as well as bispecific T-cell engagers. There are a lot of early development going on in myeloma, and I just summarized all of that in about 25 minutes.